Hello, everybody. Thank you so much for taking the time to join us today. We are really excited to be addressing the faculty and staff at YU. JScreen has a long-standing relationship with YU. We've spent the last 11 years really focusing on the importance of reproductive carrier screening for the students, and we wanted to make sure that we are addressing the importance of hereditary cancer testing for the staff and faculty so that we can, provide this information and easy access for all of you. My name is Sherry Ungerleider, and I am one of the outreach and education coordinators for JScreen. And I am so happy to be joined by Esty Rose and Gila Fifa and Melanie Hardy. And I'm going to let everybody do their own introduction.
Okay, I guess I'll start. Hi, I'm Esty. I am one of the genetic counselors here at JScreen and a very proud Stern alum. I do a lot of clinical work for JScreen, meaning I see patients and I do direct patient care. But in addition to that, I am also very passionate about outreach and education within our community. So I try to sneak away from my clinical work every now and then and try to do programs like this just because I believe it's so important for people to know that we exist and that we're here to help whoever wants the help.
And hi, I'm Gila Pfeffer. I'm a breast cancer previvor, survivor, and prevention advocate, and we'll get into what that means later. I'm also a Stern alum, but Esty and I did not overlap because I am the class of 1995. In fact, I recently dug up my old yearbook, if you can believe it. I was cleaning, I was looking through photo albums like, oh,
I
that's
love
delightful.
that.
I'm the author of a recently published memoir called Nearly Departed: Adventures in Loss, Cancer, and Other Inconveniences, which tells the story of how I lost both my parents young to cancer, how I tried to avoid getting cancer too, and what happened when I did it anyway. I'm really excited to be here speaking alongside Jay Screen, who I've come to know really well recently, and excited to be back with my old alma mater.
And I am Melanie Hardy. I am also one of the genetic counselors at JScreen and Director of Research and Advocacy. So I do some of the same things that SD does, but a little bit more of a focus on research efforts and advocacy efforts that we can use to help people access genetic testing for their benefit. And I'm here just as an IT helper, so I'll be going off camera, but I'm so excited to see everyone here and welcome.
And thank you guys so much. And I just wanted to also mention that if anybody has any questions throughout the webinar, you can address them in the Q&A. Melanie will be answering some behind the scenes, and if we have time at the end, we'll try to answer some live as well. So I just want to start off with the first question to you, Gila. So you refer to yourself as both a breast cancer previvor and survivor, as you mentioned before. Can you tell us a little bit more about that?
Sure. So I do a lot of public speaking in this arena too. And one of the first questions I ask the audience is, by a show of hands, who knows what a breast cancer survivor is? And although I can't see any of the participants here today, I know that when I ask that question, most people would raise their hands. And I say, who knows what a previvor is? And generally it's crickets, unless it's my friends in the audience who've heard my shtick a million times. A previvor is someone who has preempted um, a diagnosis or a disease that they are likely to get, either from a family history or because of their genetic makeup. And my intention was to be a previvor, and the short version of that is my mom died of breast cancer at 42. Her mom died of breast cancer at 49. My dad died of colon cancer at 55. By the time I was 30 years old, I was the oldest living member of my entire family. I'm the oldest of five kids, and I decided that enough with the early dying already, something had to change. So it was around the time that my dad died that two amazing things happened. I learned about the existence of preventative or risk reducing double mastectomies. This was well before Angelina Jolie put it on the map. So, it was like speaking Martian to people when I said this was something I was interested in doing. And also genetic testing, which is J-Screen's whole reason for existence. But at the time, it was expensive and accessible. It was a blood test. I had to do it through my doctor's office, and there was a concern around whether having some kind of genetic predisposition would make me, according to insurance companies, have a pre-existing condition, which was also scary. So in 2005, I tested for the BRCA gene and learned that I was a BRCA1 mutation carrier. Which put me at a very high risk for breast cancer and ovarian cancer. But frankly, that was not in any way surprising given my family history. I was well ahead of that. It's sort of I was just happy to have that genetic information. So in 2008, I underwent a preventative double mastectomy with reconstruction. I was 34 years old. I had 4 little kids, and I thought, right, that's the end of that. I've put my risk behind me. I don't have to worry about this anymore ever again. And 6 days later, my surgeon called and said, "You're not going to believe this. We found early but aggressive cancer in one breast. You saved your own life." So I went from being a previvor in that I took action to prevent a disease that I knew was coming for me to a survivor in that I got there a little bit too late, but thankfully, it was still, early enough that I'm here 16 years later speaking to you today. But that's you want to be a previvor when it comes to having any kind of gene mutations and family history. But a survivor is definitely, a good second best.
Yeah, wow. Thank you so much for sharing that. Esty, can you tell us a little bit about how Gila's story relates to BRCA testing as well as other hereditary cancer genes?
Yeah, so Gila's story is an amazing story, and by the way, a great read in her book. Just
Agree.
it was just like told so well and like with a lot of humor, and it's a really great book. But anyway, so Gila was positive for a BRCA mutation, but there are many other cancer genes that exist. We'll talk about BRCA more today, but it's not only BRCA. There are over 100 different cancer genes, and these cancer genes are really important, and we all have these cancer genes. And why they're important is because they have a vital job in the body, which is to protect us from getting cancer. So all of us have these genes. Every single person on this call has these genes, and we want these genes to be working properly and doing their job of protecting us from cancer. Now, sometimes people have changes or mutations in these genes, and that can cause the genes not to work properly. So again, when they're working, they're protecting you from cancer, but when there's a mutation, you're losing some of that protection. So very often when you see a strong family history of breast cancer, ovarian cancer, or any other cancer, you start to wonder, maybe this is not just sporadic. Maybe these people are not getting cancer because cancer is just a common thing and people get cancer. Maybe people in the family are affected because there's some kind of a genetic mutation that's being passed along within the family. So Gila was very smart for getting tested, and they were able to find the cause of the cancer in her family. They found that mutation in one of these genes, the BRCA gene. When somebody is positive for a mutation in the BRCA genes, they have a predisposition to certain cancers. Gila mentioned breast cancer and ovarian cancer. There's also a predisposition for men and women for pancreatic cancer. Men, in addition to that, also have an increased risk for male breast cancer and prostate cancer. For all of these cancers, it's not a sure thing. So it's not that like everybody with a mutation will definitely get cancer, but the risks are quite significantly different than people who don't have a mutation. So for example, the average woman's risk for breast cancer is about 12, 13%. If a woman has a BRCA mutation, that risk can be up to 85, 87%. So it's not 100%, it's not a sure thing, but the risk is quite high. And that's why Gila did not want to take the risk. And she said, I'm going to do as much as I can to prevent that from happening to me. And that's why she decided to have the surgery, which should have reduced the chances of her getting cancer. If it would have been done earlier, possibly, but who knows? And, I give Gila a lot of credit for taking initiative on this. Not everybody who tests positive decides to go that route. Not everybody decides to do a surgery. Some women, depending on where they are in life, might decide not to go that route, and they might decide to do much more surveillance than the average woman might do for breast cancer. So for example, she might start doing breast exams and breast imaging like mammograms and MRIs at a much younger age than a woman might typically do. She might do them more often. We could go into more details about it, but the point is that when somebody finds that they're positive for a BRCA mutation or any other cancer mutations, they need to sit down and speak to somebody about it, because very often there's something they can do about it, and they can take action either by doing some kind of preventative surgeries or preventative medications, or by doing more frequent screening to make sure that if it's going to happen, they're going to catch it early.
Great. Thank you so much for explaining that. Gila, I want to bring to everyone's attention how active you've been on social media for so many years. One of the greatest things you do, I love watching it every month. You call it Feel It on the First campaign. Can you talk a little bit about that and about why advocacy is so important to you and how you really got started with that?
With pleasure. It's my favorite thing to talk about. In fact, I wore my Feel It on the First shirt today because I'm always representing. And what Feel It on the First is a campaign where every first of the month I post a picture of me holding up two sort of breast reminiscent items, be they pumpkins or beach balls, lemons, frying pans, something to use humor to get my audience to, sort of break down the fears around breast cancer prevention, and through humor, sort of bake it into their heads. And I've been doing it, I guess, for more than 6 years now.
Wow.
If you scroll back on my Instagram, you will see, I have not missed one unless it was a Jewish holiday or a Shabbat, in which case I quickly made up for it a couple days later. Um, and it's very impactful, I'm finding, because a lot of women from around the world engage with me on this. And what's come as a result is they'll send me their own photos of things that reminded, they'll say, oh, I saw this photo, it reminded me of you, and they'll send it to me. And it's two cereal bowls that their kids finished breakfast, on the table after they've gone off to school. And the fact that they're looking at the two cereal bowls not as dirty dishes to wash, but as a funny reminder of breast and therefore breast cancer prevention is exactly my intention. Everything that I talk about, all the difficulties, including losing my parents, including undergoing the surgery and then afterward 8 rounds of chemo and having my ovaries out as well and going through menopause at 35, all those things I talk about with humor, because for me that's my coping mechanism. But as an advocate, humor is, I find, the best way to break down barriers and disseminate information. So for me, Feel It on the First is first and foremost a monthly reminder to do a breast self-exam, right? So, the immediate call to action is do your self-exam. If you haven't done it today, do it tomorrow. Pick one day a month, set it in your calendar, a reminder to come up, to do that self-exam. But it's also more than that. It's know your risk, speak to your doctor. What is your risk profile? Do you know your family history? Have you been tested for any breast cancer related gene mutations? Do you need to do that? I had my first mammogram at 30 instead of 40 because my mom was diagnosed at 40. Do you need to have earlier screening? All of my advocacy is born of my own experience. God blessed me with a big mouth, and what am I doing with it? I'm talking about my story, and it's working. I get DMs from women with these kinds of photos. I get DMs from women with, oh, I saw this online and it looks like boobs, so I thought of you. But I also get DMs from women saying, thank you for your monthly reminders. Because of you, I check myself and I wouldn't have otherwise. And then I get other messages that say, thank you for your monthly reminders. I checked myself and I found something, and I made an appointment immediately to see the doctor. And on even rarer occasions, but still it happens. And I have ongoing conversations with women in my DMs for years. It could be 6 months, and they'll write to me and give me their health update, where one of my reminders has led to somebody checking themselves, seeking medical attention, finding something, and an earlier diagnosis. And they'll say, selfie, here's me in my chemo chair, or here's me ringing the bell, I finished. And I'm going to get emotional actually thinking about that, because these are real people. Like, I'm out there with my Feel It on the First t-shirts and my pink hair, and it looks like a lot of fun, but it is having a tangible and measurable impact, one person at a time. And that's something that I'm really proud of. And I have no intention of stopping until we don't need it anymore, which hopefully will be in our lifetimes.
Yeah. I mean, social media really has helped to increase awareness in so many ways. And if you guys don't already follow Gila, you absolutely should. Love the way you spread your message. And J Screen also has a presence on social media where we help raise awareness. And maybe Esty, you could talk a little bit about how J Screen does raise awareness about the importance of genetic testing, and not only genetic testing, but genetic testing done the right way.
Yeah, so I mean, we have an entire team just to do outreach and education, and Sherry is a very important member of that team. We will meet anyone wherever they need to be met. So, you know, we understand that there are many different types of people in the community. All over the community, and we want to tailor all of our education to our audience. So whether it's going to a campus and speaking to college students, whether it's going to a synagogue or a temple and speaking to people there, speaking at a higher level to influencers in the community, whether it be rabbis, or doctors that might be very influential in a certain community, we'll go and we'll meet you there and we will educate you about what you need to know. So it's really important to us to be very thoughtful about how we do our outreach and education, and how we reach the right people with the right message. I appreciate what Gila does because she does it with humor, as I said before. And if you all start following her Instagram, you'll see that's the kind of messaging that we appreciate also, because we don't want to scare people. These stories could be very scary, but we try to empower people and make it more lighthearted, and explain to them how it's not, your genes don't have to be your destiny. There are things that you can do to get ahead of the risk for yourself, for your family members, and the information should be empowering. And that's a very important message in our outreach and education.
And I want to also mention one of my favorite things that J Screen does is we also do on-site screening events where, we'll come to your community and help make it even easier than it already is to do the testing. Gil, you touched upon this a little bit at the beginning, but can you just tell us, how did you come to decide what was the best option for you after you did the genetic testing and found out that you carry the mutation?
Yeah, and I'm saying this as somebody who was really clear and focused and concrete in her decisions. And I know that I'm speaking to an audience here, as well as in all the other advocacy work and public speaking that I do, to people who are a lot less certain, a lot less clear, perhaps more afraid, and understandably so. We're talking about prevention, and as Esty mentioned, somebody who finds out that they have a genetic predisposition to breast cancer does not necessarily have to run out and have that surgery. There's lots of other ways to be more vigilant about screening and monitoring. There are medications. That's not my area. I'm here talking as a regular person. But for me, I had clarity from the outset. I was 18 when my mom was diagnosed. My book opens in JFK Airport when I'm 18 and about to board a plane to Israel, to study post high school, and my mother blurts out to me, "I think I might have breast cancer." I'm like, "What am I supposed to do with that information?" Knowing that I never met her mother because she died when I was just a newborn. So for me, it was always on my radar. And then I was 20 when my mom died. Our youngest sister was 3 years old, and there were three in between. So my point of view, my perspective is much different to somebody who accidentally learns that they're a mutation carrier, because they've decided to do genetic testing, or even somebody whose relative had breast cancer and survived. My point of view was, oh my God, everyone's dying in their 40s. I need to do something about this. So a friend of mine, I was living in Highland Park, New Jersey, and a close friend of mine, her mom had breast cancer and survived. And one day she said she was in her 30s. I'm having my breast preventatively removed and I'm having reconstruction. I was like, well, you could do that? Who knew? I think it's been around since the 80s, but it just wasn't talked about. My mom died in 1994. We hardly had the internet then. I knew nothing of any of that. But the minute I heard about what she was going to do, and the first time I went to visit her, I remember visiting her in her house, when she was home from the hospital. I'm like, I had one baby on my hip and the other one was off to nursery. I'm like, I'm doing that. Whatever I have to do to avoid the same fate that my mother and her mother met, that's what I'm going to do. It never occurred to me. I mean, as I got closer to the surgery, I definitely got a little bit panicky, which I also write about with humor. Oh, I'm about to undergo general anesthesia for 9 hours. That sounds a bit crazy. But there was no other option for me. Finding out about the BRCA was almost a by the way. That was just information that I could share with the rest of my family. I should mention that as a result of me undergoing this double mastectomy and finding out in the process that I was already, the cancer was already there, my three younger sisters who were in their 20s and teens, who at the time never would have gone for testing. It wasn't something people were doing. They said, that sounds a bit crazy. We're here to support you, but we're not doing that. They ran out to get tested. The youngest one is negative. The middle two in their 20s found that they were also BRCA1 mutation carriers, and they had preventative mastectomies too, to much better results than mine. They saved their own lives. So for me, it was, I wish I could say that it was, such a big, brave decision I made, but I didn't see how I had any choice. And by the time I underwent the surgery, I had four little kids already. My mom wasn't around for her kids, and her mom wasn't around to see any of her grandkids. I had to do something differently. So however hard that was, not doing it, I think would have been much harder, and it turns out would have been the wrong choice for me.
Yeah, and I think that's also really important. You keep saying for me, that was the right thing for me. This was my perspective, my point of view. It's not like that for everybody. Not everybody has a family history. Some people are, they find out when they're 20 and they're not ready to go through a surgery like that. You mentioned with your sisters. Every case is really, really different, and people evolve also, right? And people's circumstances change over time. So a very important part, or a big value to having the counseling along with getting the results, is talking through that, talking through all the pros and cons of this option versus that option, and supporting people through it. And I think that's, a really important part of doing the testing. You might have seen in Target, they have 23andMe kits, and you can find out really fast, are you a carrier, are you not a carrier? That's not the right way to do it. Like doing testing not under the supervision and the guidance of a medical professional is never a good idea. But specifically, for testing like this, where really, really big decisions need to be made, it's really, really important to do it, under or with the help of somebody who knows what they're talking about, and who's very up to date with the guidelines, and who can send you to the right doctors, and who can send you to really appropriate resources, and maybe other people who've been through it and might be able to help you through it. So that's just a plug for genetic counseling. Well, might
And
as
I
well.
want to continue to plug for your genetic counseling, because
Yeah.
I wish I had had J Screen around when I was going through all this. There just wasn't that kind of access to information, those kinds of resources, and there were a lot of decisions that I was making. I don't want to say on my own. I had my doctors, but there wasn't this
Mhm.
body of professionals. And as Esty says, you can go to Target, and those are almost entertainment. They're like party favors. You find out if you're like 2% Viking, hooray! But we're talking about, the ability to make major life decisions, or take action, or, alter your behavior in ways big and small. And I absolutely am so thankful, not only that J Screen exists, but that I'm interacting with you. In fact, at a recent event that you guys did at Stern,
Mhm.
I haven't been tested since 2005. So I'm waiting for my results. I tested again because at the time they were testing for, I think it was two BRCA1s and one BRCA2. That was three genes.
Mhm.
Now there's a much wider panel. I want more of that information, and I trust. I mean, how lucky am I that I just have, immediate access? I can email you and just ask you all the questions. But people who go through JScreen can feel confident that they're getting proper guidance, proper trained counseling, and not just having to wing it and making big decisions. And the big decision could be to do nothing, but that's still a big decision that you want somebody who knows what's going on to weigh in on.
Yeah. And you talked a little bit about, why genetic counseling is such an important part of genetic testing. But I know one question that always gets asked, or really a comment when we're out there, sometimes people are saying, this is scary. I don't want to do it because I don't want the information. How do you answer that question to, patients or, somebody in the community?
So I obviously would respect that. Like I am not them, so I can't say exactly how I would feel. But I would also have a conversation with that. I wouldn't just let them leave and say, okay, then I guess you don't need this. I would explain to them why it could be important information and helpful information for them and for their family members. It might help them, answer questions that have been going on in the family for years. And I also understand that it's not for everybody, and even if it's not for them now, maybe in the future it will be for them. So just planting the seeds and letting people know that this exists and this is an option. If I've done that, I've done my job, and
Right.
if I could get them tested, I feel even better. But at the same time, I understand it's not for everybody.
Yeah, and I think just one thing that I want to stress is that everything that JScreen is testing for is actionable, meaning that if you find out you carry a mutation for one of these cancer genes, one of our genetic counselors will meet with you and help you understand what cancers you're at risk for developing and what you can do to either prevent it or detect it early. And I think that's a really important, important aspect. Esty, so many people will also say, why isn't my doctor told me about this? Why isn't my doctor recommending that I do hereditary cancer testing? What are the gaps in the current medical system, in terms of recommendations for cancer testing?
I think there are a lot of gaps. I think one of the biggest gaps is just lack of knowledge. Doctors are very busy. We've all been to doctor's offices, and we've been waiting in the waiting room for hours. Just waiting for your turn. They don't have time. So people who are medical professionals in one field, whether it be, let's say, an OBGYN or just a primary care doctor, they don't have time to do their OBGYN stuff and then also do a genetic session on top of that. And they also don't necessarily know about it, and they're not experts in this, and they don't necessarily know about having the conversation or the fact that certain tests exist that could make it easy for people to learn more about themselves. So I think it's like a combination of access, there's just no time, and also lack of knowledge and lack of education. And that's where we kind of step in, and we'll say to doctors, like, we'll take it over this part of the consultation. You just have to send them to us and let them know that JScreen is a good resource, and then we'll provide the counseling, we'll provide the testing, we'll provide all the education and the referrals and the follow-up, and we'll send them right back to you to kind of take care of them after that. So I think once we kind of get our foot in the door in doctors' offices and let them know that we're here to help them and to partner with them, I think people would be very happy to send patients to us. It's just kind of letting them know that we exist. That's a really big part of our outreach.
Yeah. Okay, great. Thank you so much. Before we, get to questions and answers, Gila, I want you to please share with us what your main takeaways from your story are.
Well, I mean, the overarching message, and that's where JScreen and I align very much, is knowledge is power, and not knowing is scarier than knowing. So when it comes to prevention, not just breast cancer, any kind of prevention in life, health prevention, mental health prevention, even things in your physical world that you can take steps to do to avoid if you know that that something's coming. However scary it is to take those steps, it's going to be a whole lot scarier if you wait around and find out. And that is what I will be screaming from the rooftops until I don't have to scream it from the rooftops anymore.
Great. And I think one other thing I really want to get to is, Esty, can you share with everybody how they can get tested through JScreen?
Yeah, sure. So obviously, I totally agree with everything that Gila said. It's always better to be proactive than reactive, right? It's better to know what you're dealing with before having to deal with it. So one way to do that is to get JScreened. So doing the test is really, really simple. All you need to do is go to our website, jscreen.org, fill out a short registration, pay an upfront program fee of $49, which we actually have a coupon that maybe Melanie could put that in the chat. We have a coupon for
I'm going to, you know what, I'll share my screen while you're giving this information and show
perfect, yeah.
everybody how to do this. Yep.
Sure. So part of the registration is paying the $49 upfront fee. And then you'll fill out some information about your personal history, your family history of cancer. Anybody can get tested with us. Even if they don't have a personal or family history of cancer, they can still get tested with us. We will send you a saliva kit in the mail. You spit into the tube, send it back to the lab, and then the results usually take about 3 weeks to come in. A consultation with a genetic counselor is always included in your testing process. If you're interested in meeting with us, we would be thrilled to speak with you, whether you're positive or negative. We'll speak with anybody. It's highly encouraged for people to go through the counseling. And it's just very simple and easy to get tested with us.
Yeah, so if anybody wants to take a screenshot of this, I would say the only step here that you don't need is step 4 because we're going to ship the kit to you. But again, if you have any questions, feel free to reach out to JScreen.
Yeah, we'll be I don't know if you noticed on that flyer, we test for more than just the BRCA genes. We're currently testing for 48 different cancer genes. So we're covering many different cancer types that may have affected you or your family members. And it's for men, it's for women, it's for people. Anyone who wants to get the test is welcome to do it. Just one thing I realized we didn't mention earlier, about 1 in 400 people have a BRCA mutation. If somebody is Ashkenazi Jewish, so if they're from Eastern Europe, back in the day, yeah, same. That risk is actually much higher than 1 in 400. It's actually about tenfold that. It's about 1 in 40. So 1 in 40 people who are Ashkenazi Jewish will be a BRCA carrier. Whether or not they have a family history of breast cancer or ovarian cancer, that risk is 1 in 40. So I personally think it's worthwhile for anybody who's Ashkenazi to be tested, even if they don't have a family history. But like I said before, anybody can get tested. It doesn't make a difference what their background is. I just would certainly recommend it for people who are Ashkenazi Jewish and or people who have a background of or a history of cancer in their families.
Thank you. Okay, there are a few questions that I want to get to. First, for Esty, is there a specific age at which you would recommend people have testing?
That's a good question. So I would say definitely not young children, teenagers. There's no reason for them to get tested. Generally speaking, when we're doing genetic testing on people, the goal of doing the testing is so that people can use the information to possibly make changes to their medical management, right? So what are they going to do with this information? So the earliest age at which somebody might actually do something about it, if they're positive, would be for females at age 25. We do recommend that they start doing their breast cancer screening, which is not typical for a female, right? Usually people will start doing mammograms at around 40, but if we find that they're positive in their early 20s or mid 20s, they're going to start doing some type of breast imaging, like an MRI. So for a woman, I would say it would be a good idea to start thinking about the testing by the time they're around 25, because that's when they're going to actually do something about it. For males, I don't think it's that necessary for them to do it that young if they're not interested in having the information, because not much is going to change in terms of their medical management. However, something that we didn't mention that I'm happy to get in here is that these mutations are passed along in a family. It's 50-50. So if somebody has a mutation, each of their first degree relatives, so that's their parents, their siblings, their kids, has a 50% chance of having the mutation as well. So if somebody might use this information of knowing that they're positive in terms of family planning, if they might choose to use assisted reproductive technologies like IVF to make sure that they're not passing along the mutation, which is amazing that that is something that is out there in the world, they would have to know their status before they start having their kids. So let's just say I'm talking to a 23-year-old whose mother or father has a mutation, and they want to make sure that they're not passing along a mutation to their kids. They need to know if they're positive or negative before that. And if they find out that they are positive and they have that 50% chance of passing it along to their kids, then they can use IVF to create embryos and test them in the lab before implanting them and before using those embryos to have a pregnancy. So that might be one reason for people to test younger if they might use it for reproductive reasons, but otherwise I would say like mid-20s is probably a good age to think about testing.
Okay. Another question. They just keep coming in. Um, Somebody asked, how often do you recommend getting tested? I know that more genetic markers are added with time.
Yeah, so Gila is the perfect example of that.
Hmm.
In when the BRCA genes were just discovered, it was much more common to do testing just for 3 mutations in the 2 genes, so 3 total. Now we have a technology where we're scanning the entire gene from the front of it to the back of it. So the technology has just improved, and we're able to pick up more BRCA carriers that way. In addition to the technology changing, we've also learned more about other genes. So it's not just the BRCA genes. There are many genes, as we discussed earlier, and we're constantly learning more and more. So somebody who went for their first genetic test in whatever year that was, 1994 or whatever you got tested, is having a completely different test than somebody who's getting tested now. We're testing for more genes, we're using a better technology, and that's going to continue to happen. So I would say maybe to check in with the person who did the test for you, with your genetic counselor, every couple of years, to see if there's an updated test available. Sometimes it makes sense, sometimes it doesn't make sense, but it's always good to know what's out there and see whether we can figure out what's been going on in the family.
And if somebody had done the reproductive carrier screening through JScreen, does that cover the cancer genetic testing as well?
No, so there are many different types of genetic tests. Some of them are kind of like predictive tests like this, right? If you know you're
Hmm.
positive, that's kind of predicting that you might get a cancer. And other genetic tests don't predict that somebody themselves might get something, but it could be informative for them having children. So for example, like our Tay-Sachs test or cystic fibrosis, all of that is part of our reproductive carrier screening. When somebody's positive, it doesn't mean that they're going to get the condition, but it means that they could potentially have a child with the condition if both them and their partners are both positive for the same thing. So when you find out that you're positive for Tay-Sachs, for example, you're not finding out you're going to get it. You're finding out that you're positive, and you want to just make sure that your partner is not a carrier as well. This is apples and oranges in terms of genetic testing, right? Predictive testing is very different than carrier testing. And we don't like to mix the two because it could be really confusing for people when they get their results report. Wait, so I am a carrier for cystic fibrosis and I also might get breast cancer. It's kind of like too much at once. So it's really important for us to just kind of lay it all out there and educate people about what this test will tell you versus what that test will tell you, and give people the option of choosing one or the other or both. Some people choose to do both, but they're not going to be done simultaneously, or like they're not going to
Again, the
be on the same lab report, right? They're
right.
going to
And
be,
again, the importance of genetic counseling.
yeah.
Next question is for Gila. Do other members of your family feel differently about testing and screening? And if so, do you talk to them about it? I think you talked a little bit about like your sisters, but other members of your family or your children.
Yeah, well, this is an important question. My kids are, they're not little kids anymore. I've got kids in their 20s and teens, and we certainly talk about it a lot. They follow me on Instagram. They know, what I talk about. They've watched me in the 2-year run up to publishing this book, and they see me traveling around the world giving these talks. And they're very, 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 very conscious and aware of breast cancer, of our family history, and of the possibility of them being carriers. And none of them is the age yet where, by my guidelines and by Estee's guidelines that she just mentioned, would uh, it would be appropriate to test yet. But we're getting there. I have a daughter and 3 sons. I think the conversation is different with my sons. I wish it wasn't. For me, I would think it would be beneficial for everyone to test. But again, as Esty said, what are my sons going to do about it other than have that knowledge? Whereas my daughter, it's a different conversation, and it's one that we are not all day long obsessively, but
Mhm.
one of those actively having. It's in the background. Um, I'm really comfortable talking about it, but I'm also conscious of the fact that for me, as I said earlier, the decision was very much, putting out a fire like, oh my God, I need to do this now. Thank God my kids have had a different experience. They've had their mom around. All the things I went through happened when they were so little. When I was diagnosed, they were 1, 3, 5, and 7. They have no recollection of it. I only told them about it so many years later, when I was going to give a talk about it somewhere, and I had to fly away and say, well, here's where I'm going. But I told them from a place of safety when all the drama was behind me. And it was a beautiful interaction that I had with them, and I was able to have that important conversation around this is in our family, whatever it looked like to them as kids. So, yeah, we talk about it, but I think we can only really get to a point where they're ready to have testing when there's something to be done about it. And that's a tricky thing. And it's one of those things where, you want to give your kids adversity so that they thrive, but you also want to give them a really safe and cushy life. And like, what decisions do they make on the back of that? So but we're just going to watch that space.
Great, thank you. Another question just came in. Esther, I think this one is for you. Is it possible to have a mutation in both copies of the gene versus just one copy? And does that matter?
Yeah, so we have 2 copies of every gene because we get one from our mom and one from our dad. So it sounds to me like this person's asking, like, let's say both of your parents have a BRCA mutation, what
Mhm.
would happen with you? So interestingly enough, the BRCA genes could present themselves in 2 different ways. So the first way is the way that we've been talking about today, but up until now, where if somebody has one mutation, they have those predispositions to certain cancers. If somebody has 2, if their mom and their dad were both carriers and they both pass it along, that presents a completely different condition called Fanconi anemia, which is a bone marrow disease. Usually that affects babies. So if a baby is born with one mutation from mom and one from dad, they will have Fanconi anemia. Fanconi anemia, in addition to being bone marrow, to causing bone marrow issues, also causes a very high risk for childhood cancers like leukemias. So it presents totally differently. It's not that common that it happens, but it's a very big part of our counseling. When I'm speaking to somebody who's positive, who's of reproductive age, I'll talk to them about both ways it could present itself. So I'll talk to them about their own cancer risks and what they can do about it. And I always recommend that their partner also get tested, just for family planning reasons. And if they do find that both of them happen to have a mutation, which happens, especially when we're dealing with a higher risk population like Ashkenazis, we'll talk to them about what they can do to make sure that their kids don't have Fanconi anemia, like IVF, like we discussed before, and some other options. That's just one of many.
Okay. Let me see. I think there might be one more question. I guess just one last question that just came in. Are there other cancer risks aside from breast cancer that the Ashkenazi Jews are more at risk for?
Yeah, so the BRCA mutations, like I said, about 1 in 40 Jewish people are Ashkenazi Jewish people, are carriers. There are other cancer genes that we'll see mutations in that more often in the Ashkenazi population. Like there's one common one in a colon cancer gene that we'll see that causes a predisposition to colon cancer. That's probably like the most other common one that we see other than BRCA. Which is why I think it's important that people do these larger panels and they don't just say, okay, I'm Jewish, I need to do the BRCA test. I think it's better that people kind of cast a wider net and test for as much as they possibly can while they're doing the testing.
Great. And one more just came in for you, Gila. In hearing from people who, who see you on social media with your monthly check-ins, do you ever encounter people who are unsure whether they might feel something and are too scared to get it checked out or to, see their doctor?
Yes. I like to say that I have, we all have different friend groups and different communities. One of my very legitimate, thriving, and active communities is my social media online community, and I have plenty of ongoing, and by ongoing I mean years, conversations with women, and I absolutely have encountered that. And I'm here as an individual who had an individual experience with genetic professionals, with medical professionals, and my number one message to people, aside from the don't be afraid,
Mhm.
is seek reliable medical intervention and attention. Have everything checked out. And I share with them also, and I'll share with you that 16 years later, I don't have any breast tissue. In my preventative surgery, we used my stomach fat and muscle for reconstruction. So all I have is a bunch of stomach fat up here. But it's impossible to remove every last bit of breast tissue. You know, our breast tissue goes up until here and into the armpits. So I've been going twice annually to see my breast surgeon for a checkup. If something looks even remotely that we don't like it, I go for an ultrasound. I can't have mammograms anymore, but I've had an ultrasound. One of them a few years ago led to a biopsy, which was my first one ever, because remember, I backed into this. I never had a biopsy in my breast tissue. And as annoying and awful as all of that is, it boils down to I have come this far to be preventative. I will continue to do so. So if someone is ever unsure of what they're feeling, unsure of what they're finding, afraid to find out, there's really only one way to get that reassurance. And I cannot stress enough how the not knowing, if you're walking around with a lump and you're not sure what it is, wouldn't you rather find out that it's a benign cyst or calcifications or something else, non-problematic, than let that cloud hang over you? So absolutely. And while we're on the subject of people in my DMs, I am very responsive. I'm a real person on the other end of the Instagram DMs. I can also be reached through my website, gilapfeffer.com. There's an email box, and I check it regularly. I take this work very seriously, and while I can't offer any medical advice, I know exactly who to send people to and which organization to send them to, and that's a very powerful tool as well. So please don't hesitate to reach out.
Something I just wanted to add, but can I just add something quickly, Sherry?
Yeah.
Like, Gilip's reminded me of something that I wanted to not forget. We mentioned earlier that the testing changes over time as technology gets better, we learn more about genes. Not just the testing that can change over time, it's also the guidelines about what to discuss with people who are positive. The guidelines change a few times a year, actually, as we have more and more people out there who are getting tested and the doctors are learning more and more about treatment and prevention. Things change. So a conversation that I might have had with somebody a year ago might be different than a conversation I might have this afternoon about people who are BRCA positive. It's true. Like, I do have a different conversation. So it's important that people stay up to date with not only the testing, but also the interpretation of the testing, right? And that they speak to somebody who's up to date with things, so that they're getting the most current recommendations that there could be.
Okay. So we are getting more questions in, but we don't, I'm afraid we don't have time to address them all. So before I get to we probably have time for one more. I just want to emphasize that you guys can always reach out to us, info@jscreen.org. You can reach out to Gila through her website or her social media channels. But this is actually a really important question, so I want to make sure we get to this. So someone said, my mom did 23andMe and tested positive for BRCA. Is that the same thing as JScreen?
It is not the same thing as JScreen. So I mentioned it earlier that you could get that at Target. JScreen is a different test. So we use a commercial grade lab. We use the OG, the most original lab there could be for BRCA testing. It's called Myriad Genetics. They're located in Salt Lake City, and they were the first lab to do testing for cancer genes at all, specifically the BRCA gene. 23andMe is not done at a commercial lab like that. I don't know where they do their testing, but it needs to be done in a certified lab that has government overseers making sure that everything is done, kosher and done the right way. So it's the lab that's not the same. The technology that they use is not the same. We mentioned earlier that when Gila was tested, she was only tested for 3 mutations, but now we're looking at the entire gene. 23andMe
I also want to say that they've been around so long that Myriad is the one that did my testing. They were the only game in town.
Yeah, they were the only game in town.
You're back again.
Yeah. So when Gila was tested with Myriad at the time, they were only testing for 3 mutations. That's what 23andMe is doing now. Like, they are very, very behind on the times. Nowadays, if you come through us or really any clinical grade genetics place, they'll be testing for the entire gene, not just those 3 mutations. So it's the lab that we're doing it in is legit. The way that we're doing the testing is as up to date as it can be. And most importantly, I said it before and I'll say it again, there's no counseling along with results at 23andMe. And
that-
we have people come to us all the time for like second round of testing. You know, they'll say that they did 23andMe and they found out that they're a BRCA carrier. And sometimes we'll see different results in both directions. You know, people will say, oh, I did 23andMe and nothing came back positive. And we'll find something because somebody might be a carrier for a mutation that's not one of the big three. And sometimes we'll see the opposite where somebody's positive with 23andMe and we don't see that. Well, just a few weeks ago, I don't know if Melanie remembers, we had a patient just like that. And I was like, okay, this is weird. And it's scary because people could be having gigantic surgeries for no reason, you know, based on a test that wasn't done properly. So genetic testing for cancer and all genetic testing should be done under the supervision of somebody who knows what they're doing and is an expert in genetics.
And this is
we all know
the
that.
last thing I think we have time to address, and I think this is really important also, but someone said, can I speak directly to a genetic counselor with JScreen?
Absolutely. So me or Melanie or any of our other genetic counselors have a very open schedule. We will always make time for our patients anytime, day or night. We will always make time to speak to people, whether it's right when the results are ready or 6 months down the line or 3 years down the line. We're your genetic care navigators. You know, we're there throughout the whole process with you and your family. If they want to speak to us, as long as you're okay with it, we're okay with it. We're really just here to help, and we want people to make sure that they understand everything so that they can make the right decisions for themselves.
Oh my gosh. So thank you, SG. Thank you, Gila, for sharing your story, SG, for shedding light on the importance around hereditary cancer testing. Thank you, Melanie, for moderating all the questions. This was absolutely incredible. I mean, SD understands how long we've been waiting to do this and how exciting it is for us to be able to provide this information for the staff and faculty at YU. So did anybody have one last thing to say, or?
Just thank you, everyone who took the time to be here today. You obviously prioritize health and well-being, and I hope that whoever's watching this in the recording also takes away, plenty from this talk. And no question is too silly or too small. Ask all the questions. And I just remembered one more thing I wanted to share. In addition to being a Stern graduate, in my book, I do write about briefly my time at Stern. So I think it's really cool that 30 years later, I'm talking to my alma mater about my memoir that partially takes place in Brookdale Hall.
Yeah, we were just there 2 weeks. All three of us were just there a few weeks ago doing a screening event, and it was just like felt like home. You know,
Yeah.
We were back home. So thank you all for attending. Sherry, how do people watch this not live? Will it be posted?
So-
Will it be emailed?
Yep, so this was recorded, as we said at the beginning, and we're going to be sending the recording over to YU so they can email it out or post it. So they will be in touch, and we will also be following up with anyone who was part of this webinar with, the code again, so you know how to go about getting tested. And again, you can reach out to us, info@jscreen.org. So feel free. Thank you guys so much. This was really a pleasure.
Thank you. Thanks for organizing this.
Bye-bye.
Bye.